Well, my name's John Fahey. I'm an ex-intensive care paramedic. I worked on the mobile intensive care ambulance system in Melbourne. My area of expertise is within the emergency medical environment. But more than that, it's within the emergency medical environment in the pre-hospital setting. And my focus is on the first 30 to 60 minutes. So what we bring to the table for GPs and others is that an appreciation of the logistics of an emergency in the first 30 to 60 minutes. So not just the clinical things you need to know, the equipment you need to think about, but how you need to organise your staff, how you need to organise yourself, and the sort of processes you need in place to ensure a professional and effective response to an unexpected event in your practice. Emergency medicine is certainly becoming more sophisticated. For example, I was looking at a report just the other day where an ambulance service is actually operating an ambulance with a full CAT scanner, a full CAT scanner in the vehicle, so that they can carry out scanning of stroke victims as close to the time of the stroke occurring as possible. So the vehicle goes to the patient and they put the patient on the stretcher, put the stretcher inside the scanner, and they scan the patient. Now, that is a very sophisticated approach to the problem. But the simplicity lies in the fact that a number of stroke victims, a very large number of stroke victims, can benefit greatly from immediate anticoagulation therapy if they're identified. And so in some respects what you're doing is quite simple. You're identifying that cadre of patients and giving them the anticoagulants. The complexity lies in the piece of equipment that you're using, and it is cumbersome, etc., etc. But what I see in the emergency medical field, affecting general practitioners and all of us, is an increasing degree of sophistication, but actually a reduction in complexity. So there's a lot of change in the emergency medical area. Look, the value of GPCE is that it brings GPs together from various practices and backgrounds. It mixes rural practitioners with their urban colleagues, and it allows those practitioners to come into contact with people like myself whom they may not otherwise come into contact with. And so there is an exchange of ideas, an exchange of views. There is a learning process that goes on above and beyond what you're doing formally in terms of your training and your ticking the box type approach to things. It also, for better or worse, allows people to see what products are coming onto the marketplace, what is good about them, what is bad about them, how they present. You know, it's about information flows. It's about educating people by letting them see and play with things, and that's very, very valuable. And I think that's one of the big advantages of something like GPCE. I suppose if you want to look at what we do in terms of the training of medical practitioners in general practice for how they manage the emergency incident in their practice, it is that increased sophistication should not mean increased complexity. You can have a sophisticated response and yet keep the actual procedures and techniques very simple. That can be achieved, and it's about simplicity without it's a simple approach, but it's about sophistication without complexity. So if you're looking at what we do, we don't dumb things down, we simply remove the unnecessary complexity from them, and that's the process that we take forward. Within the general practice environment, I suppose the biggest example of it, in fact in the whole acute environment, the fundamental observations of a patient's clinical state rely on their conscious state, their skin condition, their pulse and their respiration. You can do pulse oximetry, you can do capnography, you can do blood pressures, but all of that is complexity. If I look at a patient and they're semi-conscious, pale, cold and sweaty, I know that patient is critically ill just by looking at them. So in our education, we try to emphasise the importance of the clinical perspective where you keep it simple but sophisticated and you remove the complexity. And so if you look at a patient and they've got pale, cold, sweaty skin and they are confused or unconscious, you know they're shocked. You know they're going to die within the next 60 minutes unless you do something effective for them. And so I can't think of a simpler way of measuring a clinical state than conscious state, skin condition, pulse and respiration. So that's an example of what I mean by being sophisticated without being complex.